Do you know what HIPAA compliance means for health information managers? Welcome everybody, I'm Davo Too Short, your guide through the complexities of this critical field. Today, we're focusing on one thing: HIPAA compliance, an essential tool for all health information managers. HIPAA, which stands for the Health Insurance Portability and Accountability Act, isn't just about rules and regulations. It's a pledge to protect patient privacy and secure their information. So let's dive in and unpack the core components of HIPAA compliance. First, we need to understand the fundamental principles of HIPAA. The privacy rule of HIPAA lays down the guidelines for safeguarding individuals' medical records and other personal health information. It also bestows upon patients several important rights. There's the right to access, allowing patients to view their health information, the right to amend, which permits them to correct errors, and the right to request restrictions, which gives them some control over how their information is used. Next up, the minimum necessary standard. This standard dictates that healthcare professionals should only access and disclose the least amount of protected health information, or PHI, necessary for the task at hand. This principle reduces the chances of unauthorized access and enhances patient privacy. Now let's move on to the security rule of HIPAA. This rule is all about electronic protected health information, or ePHI. It mandates that covered entities must put in place measures such as access controls, encryption, decryption, and data backup. Risk analysis and management also play a vital role in HIPAA compliance. Regular risk assessments are crucial to identify possible vulnerabilities and to devise appropriate risk management strategies. Security awareness training is another key element in HIPAA compliance. A well-trained team is the first line of defense in protecting patient data. The HIPAA breach notification rule is there to guide us in case of a breach, which is any unauthorized use or disclosure of PHI that poses a risk. Healthcare professionals must act promptly to investigate and mitigate such risks. Finally, we come to the 7 fundamental elements of an effective compliance program for HIPAA. These are: develop policies and procedures, designate privacy and security officers, implement effective training programs, ensure communication channels, monitor compliance, enforce sanctions policies, and respond promptly. HIPAA compliance isn't just about ticking off boxes on a regulatory checklist. It's about ensuring the privacy and security of patient data. Understanding these HIPAA essentials is a fundamental part of providing top-notch patient care. Hopefully this guide has shed some light on HIPAA compliance for health information managers. If you found this video helpful, give it a thumbs up and subscribe for more insightful content. We'd love to hear your thoughts in the comments. Thanks for joining us on this exploration of HIPAA compliance essentials. Until next time, keep your data secure and your patients' trust intact.